About 65% of Americans are now overweight or obese, according to the Centers for Disease Control and Prevention, and they have a higher risk of having sleep disorders. We spoke to Dr. Dennis Nicholson at Pomona Valley Hospital Medical Center and asked him what is the connection between obesity and sleep disorders.
People who are overweight or obese have an increased risk of breathing problems during sleep. Some might call it sleep apnea, where the air passage is blocked during sleep. The breathing problem is actually an obstruction to the airflow that occurs when you go to sleep. And the reason for it is that the air passage is held rigidly open when you're awake because of the muscle tone. So even people who are overweight or obese don't struggle to get air unless it's extremely serious obesity until they go to sleep. And then the muscles relax. The weight factor causes fatty tissue accumulation, which encroaches on the airway and makes it smaller, and also the relaxation of the muscles in the airway when people go to sleep add to that, and then you can't get air in as you breathe in because the muscles in the airway relax and the air passage actually collapses. The long-term and short-term consequence of this are daytime sleepiness, not unrefreshing sleep, cognitive changes sometimes where people have trouble with memory. As most of us know, when we haven't had enough sleep, it's tough to think. And longer-term high blood pressure, stroke, heart attack, and so on. So there's a lot of cardiovascular consequence. Obesity is a contributing factor, not the only factor. For example, the size of the air passage to begin with, or the degree of relaxation of the muscles, and that is male-female differences, so that a man who's thinner could still have sleep apnea, or after the menopause, a woman who's thin could have a breathing problem during their sleep. But weight is a major contributing factor. There's a sleep heart health study, which was a major study that confirmed that there is thought to be an increase in the incidence of stroke. There is a contributing factor to things like heart failure. In addition, as far as the brain goes, there are studies now with MRIs and various radiologic studies that show actual damage to little areas of the brain because of lack of oxygen. It makes sense, if you're not getting enough oxygen repetitively during sleep, that these areas of the brain that aren't receiving a lot of blood to begin with can be damaged.
Dr. Nicholson examines the treatment options for sleep apnea.
The standard treatment is currently a positive airway pressure device. Most people know it as CPAP. Is very good in that it's safe, extremely safe, and it's effective over 90% of the time. However, it's not a cure, and it's still a contraption that you have to work with it. So I would advise strongly for people to work with a center, accredited center if possible, that has support so that they can help the person get used to it. There are alternatives, including dental devices that moves the jaw forward. And by moving the lower jaw forward, create more room in the air passage. That is effective maybe 50% of the time, and mostly for mild to moderate cases, but we have used it in more severe cases.